have you tell me your name and just what you're running for, just to get a level check.
Lucas Overby, candidate for the United States House, District 13 special election.
All right, great. The audio looks good here, so why don't we begin and tell me, why are you running in this election?
Well, I got a very long background in activism and in human rights work, and when I got given the opportunity to run in this race against Congressman Young last year, it was a fantastic opportunity for me to kind of expand on that and get into the legislative side. I've always been interested in federal government policy, and the race had an open seat for my party, so we decided to take it on.
You say human rights activism. Give us an example.
I've done work in women's rights, rape crisis counseling, medical marijuana, worked on some immigration reform policy, kind of a mixed bag. Wherever we thought we could help when we were younger, we did. So we've been all over the place with it.
One of the issues in Pinellas County is rising flood insurance rates. Now, the FEMA just came out with a plan to delay the increase in flood insurance rates that's hitting a lot of Pinellas homeowners hard. But despite that delay, what would your solution be for rising flood insurance rates?
We've reached out to both the insurance companies and other politicians to try to start working on that. We did just get some new information in from a lawyers group that deals with foreclosures, and we are working our way through a mountain of information. We have actually now have concerns with the delay itself. It may not protect homeowners like we had originally thought. So we may be looking to revamp that delay as well. I am in favor of assisting Jeff Brandis with his option of expanding private coverage inside of the state of Florida. That is going to take some deregulation, the regulations that started pushing people into the national system. We're going to have to remove those barriers. I do agree with one of my opponents on we need to figure out what happened with those maps, why FEMA jumped us the way that they did. That kind of information not only good for trying to maybe negotiate the national rate down, but also if we are going to expand on the state or private side, we're going to need that information for them to be readily available and accurate.
If there is deregulation and it's opened up to more private companies being able to provide flood insurance to homeowners instead of FEMA, could that be happening already? Are there companies that are willing to take on that risk?
As far as I'm aware, there are. I haven't gotten a chance to work as closely as I would have liked with the Florida side legislation, but I know we had them in the past, and it's very similar to some health insurance policies in the state of Florida. When the state opened up state options or was pushing for federal options, they started clamping down on the ability for these private companies to operate. One of my big concerns with doing a big overhaul of the federal project or even expanding it is we may find ourselves in this position again in 10 years. The system's already failed. What's going to prevent it from failing again? And what I don't want to do is kind of put my finger in the dam and then have the whole thing come crashing down around us. That's not going to be good for homeowners, and it's definitely not going to be good for our property values.
I want to turn now to the Affordable Care Act. It's also called Obamacare. There was a trouble with the rollout of the website. There are a lot of Republicans that want to repeal Obamacare completely. A lot of Democrats say, give it time to work. What's your take on medical insurance?
For ACA, I have strong concerns that it doesn't affect the actual causes. And there's, programs like Affordable Care Act, there's the concept of single payer. Even if you were to move to those without doing anything to the actual healthcare industry, without helping the healthcare industry at all, we're going to continue to see rising costs. So even if everybody had insurance, if you can't pay your mortgage after paying your insurance, you're still in rough shape. So what we've focused on is trying to change that conversation to there's things that Congress can do, that problems that they've caused, let's fix those first. And some of the big ones that we've talked about and we've looked into is doctors are required to charge certain amounts, and it's higher than what Medicaid would be charged. So for private insurance, it costs more to go do that. You may not see it because you're paying your insurance premiums, but that's going to drive insurance rates up. Licensing is an absolute nightmare for a lot of fields, especially the specialties. We license them once, sometimes twice at the federal level, then at the state level, then sometimes at the local level. It's an awful lot of licensing. Why don't we just pick who's going to do it and stick with it? And a lot of those licenses have to be redone quarterly. So that's another cost that we've added on. ACA increased taxation, but there was already a substantial amount on medical equipment and on certain procedures. The doctors had to pay taxes on top of taxes. That's going to get passed on to the consumer. So we've been focused on, if we can get the cost of care down, then we can really start working and figuring out what we're going to do with insurance. Now, one of the places that I go divergent from both of my opponents is the gridlock that's been caused and the argument over, are we going to use the Republican version of affordable health care or are we going to use the Democrat version? Well, it's a great argument, except the insurance companies have no idea what's going to go on in 2015. So right now, some of the good products that they had, long-term planning products, multiple year policies that locked in rates, none of those exist right now because no insurance company wants to write anything for beyond 2014. We have to move the process forward. Now, I am in favor of repealing the ACA and moving forward with healthcare reforms on the actual care side. However, the argument's going to kill us. So I am willing, there are portions of the ACA that I am willing to work with. If we have some non-starters, we have some stuff that's good, I would be willing to keep it just so we can get moving forward, get some certainty for the consumer, and start getting costs down.
For programs like Social Security and Medicare, are there things that you think that would enhance those programs, or do you support those programs?
While I'm not a big fan of the federal government doing those things, it's not inside their purview, people have paid for them. Those are entitlement programs people have paid into, they're expecting a return on it. There is no simple answer for them. There are a lot of waste and fraud stuff that we'd like to start working with. I got to have a fantastic meeting with AARP. They're very interested in some of the volunteerist ideas that we've brought forward. Is it anything we're going to be able to do in the short term? No, but I am opposed to raising the cap that increases what the output should be. I'm opposed to decreasing what the payout's going to be, because that's not what we promised the people that were paying into that system. And this is one of the benefits of being the youngest of the candidates. I don't want to pay for the generation ahead of me that's putting the bill on my generation. But then again, I don't want to push it back to my daughter's generation either. So any plan that turns into, well, we're just going to cut it off at X date and everybody below this date's not going to get it, well, we're still going to pay for it, because the way the system transferred in the 80s, it's a pay-in, pay-out system. It's not a trust anymore. So either we bring it back to being a trust where it was a viable system, or we define something else. But cutting it off and going, okay, everybody below X date has to pay for it but doesn't get it, and everybody above X date gets it, that's simply unfair and it's unrealistic.
Thank you. Those were my only questions. Is there anything else our listeners should know about your candidacy?
Actually, if your listeners have any questions for me, I've taken great pride and great pains to make myself as accessible as possible, especially with the way reporting gets done these days. Sometimes there's questions that come up. They can go to my website, which is lucasoverby.com, or even better, if they're on social media, I try to keep it on me at all times. It's facebook.com/lucasoverby4Congress, FOR Congress. Shoot me a message if you have a question about something that I've said, or don't understand something I've said, or want further explanation, or a policy maybe we haven't touched on yet. Bring it up to me. A large majority of our platform has been built on and designed specifically from the community. We've been on the trail for over a year now. We spent the last month and a half hosting nothing but town halls, meeting with small groups of people, and asking what they want to see done and how they want to see it done, and seeing where we can apply libertarian ideals to that to start moving the ball forward. So I encourage everybody, please reach out to me, ask me whatever questions you like. We don't filter anything, and I take great pleasure in getting to work with the community on this.
Thanks so much for your time today.
Thank you.